Hello and welcome. I'm pleased to share with you an overview of the common and uncommon causes of back pain in children, along with some factors that aggravate or relieve these conditions. So today we are going to explore what happens when a child experiences back pain, how certain movements can exacerbate it, and what factors can help alleviate it. So let's start. So back pain in children is often overlooked because we typically associate back pain with adults. However, recognizing the specific causes as well as their aggravating and relieving factors is critical. Early identification and proper management can prevent long-term complications and ensure that children stay active and healthy. I will present a table that categorizes various pediatric back pain causes in one column, then highlights the common clinical features, factors that make the pain worse, and the factors that bring relief. So let's go through each cause in a clear, systematic manner. So let's start with the first one, that is muscle strain or poor posture. Now the clinical features of this condition is that the pain is from prolonged sitting or carrying heavy backpacks, and this pain is often localized to the lower back. This pain in children is aggravated by a poor posture, it is aggravated by prolonged sitting and carrying heavy loads like heavy backpacks or school bags. It is usually relieved by rest, improved posture, and by stretching exercises. The second important cause is spondylolysis, which is also known as stress fractures of the pars interarticularis. The clinical features of this condition is that it's common in young athletes. In what happens in them is that this pain, lower back pain, intensifies with hyperextension movements where arch your back backwards, for instance in gymnastics or in dancing competitions. This type of pain is aggravated by extension or arching the spine and relieved by bending forward, rest, and avoiding hyperextension. Then the third important cause is known as the forward slipping of a vertebra, which in medical terminology is known as spondylolisthesis. The clinical features of this is that it's usually a chronic low back pain. This back pain is ongoing for a long period of time, and you might see that there is an exaggerated curve of the lower back. We call it the exaggerated lordosis. This type of pain is usually aggravated by extension of the back. Usually it's aggravated by physically demanding sports like football, rugby, and it's also aggravated by heavy lifting. This type of pain is usually relieved by forward flexion, in which the child flexes forward, reducing the spinal load and taking some rest. The fourth important cause is spinal stenosis. Now, the clinical features of spinal stenosis is that it's a back pain caused by the narrowing of the spinal canal, and this back pain is a typical type of back pain which improves with bending forward. So when a child bends forward, it helps them in their pain. You might also notice that the child might complain of discomfort or fatigue in the legs when standing or walking for a prolonged period of time. This type of pain is aggravated by extension or walking upright for long periods of time and for standing for a prolonged period of time, while it is relieved by bending forwards, leaning against a surface, or sitting. A fifth important cause is a herniated lumbar disc, in which what happens is that the intervertebral disc slips backward and irritates the roots of the spinal nerves. The clinical features is that child has got a back pain that worsens with bending forward. So this type of pain is made worse when they bend forward. It might even radiate into one or both of their legs, in which condition we call it sciatica. This type of pain is aggravated by flexion, by prolonged sitting, and by lifting heavy objects, while it is relieved by extension, lying down, taking rest, and sometimes doing gentle stretch exercises. Then we have got a condition known as the Schumann's kyphosis, which is basically a rounded upper back, which we also call as a kyphotic curve, and this usually occurs in teenagers, and usually they've got the mid-spine pain of the upper back. Usually it's aggravated by prolonged standing and doing intense activities, while it is relieved by rest, by improvising their posture, or doing some physical therapy in which they have got extension exercises of the back. Then we have got a very important category of JIA, juvenile idiopathic arthritis, which is the equivalent of rheumatoid arthritis in children. The clinical features of this condition is that these kids have got morning stiffness, and it's usually a prolonged condition. They have got morning stiffness, that is stiffness in the back or in the joints early in the morning, and this stiffness actually eases as the day progresses, and you might see that there are other joints involved like the ankles and the knees. This type of pain is made worse by prolonged inactivity, particularly overnight or early morning, while it is made better by gradual movements, by taking anti-inflammatory medications, and by doing some physical therapy. Then we've got another important cause of the lower back pain, a bit rare, which is known as infectious discitis, or also called vertebral osteomyelitis. The clinical features of this type of lower back pain is that it's quite severe. It's very severe. The child cannot sit comfortably. It's very severe, and it's localized. Rather than this pain being spread over the back, it's usually localized to a particular part of the spine, and it can be accompanied by some fever, mild grade fever, or generalized malaise or feeling unwell. This type of movement is made worse by doing spinal movements or lifting anything. We call it loading the spine. This type of pain is relieved by rest, though even rest sometimes doesn't make it better, and the pain persists unless and until the infection is treated. Then rarely we can have, especially in the tropical countries or in the poor countries, a condition known as a Pott's disease, which is also known as a tuberculosis of the spine. The clinical features is that usually there is a history of tuberculosis in the family. These kids, they've got chronic back pain, they've got systemic signs like weight loss, they might have low-grade fevers, they might have cough, they might have night sweats, and sometimes you might see spinal deformity, which is also known as gibbous. This type of pain is aggravated by movement or any loading of the infected area, while it is relieved by rest and through definitive therapy, which is we call anti-tuberculous therapy, which is usually given for many months. Then we've got the tumors of the back, especially the osteoblastoma or certain malignant tumors like Ewing sarcoma, and even blood cancer like leukemia can also give you back pain. These types of children have got a persistent or nocturnal, the nighttime back pain. Now, especially the osteoblastoma is particular type of back pain, which is usually relieved by anti-inflammatory drugs, while the other tumors like Ewing sarcoma or leukemia might have systemic signs like fever and weight loss and pallor. This type of pain is usually aggravated by various factors, especially it's quite worse at the night, and it's also worse with the movement. While relieving factors usually like pain medication, they don't work except if the condition is osteoma. The only thing that would relieve is probably giving them some specific therapy like surgery or chemotherapy. Then we also have got the scoliosis-related strain, where scoliosis is a visible spinal curvature caused by uneven shoulders or hip, and that causes mechanical back pain. It's usually aggravated by prolonged sitting or sitting in a poor posture, while it is relieved by rest or sometimes by targeted physical therapy or bracing if indicated. Some teenagers might also suffer from psychogenic back pain, in which there is no physical cause for back pain. Usually the clinical features of these kids are that when they are investigated, they've got all normal and clinical evaluations. It's usually associated with stress. It might be stress in the child, might be stress in the family, anxiety, and some other psychological factors. Usually this type of back pain is aggravated by stressful conditions or by unaddressed psychological concerns, while it is relieved by counseling, by relaxation techniques, and if you address the underlying stress factors. Then lower back pain can also be caused as a referred frame from other sides. The clinical features of a referred lower back pain is that usually the pain arises from non-spinal sources. For example, if somebody has got kidney stones or somebody's got like pelvic conditions, and these types of pain, like they may not follow typical back pain patterns. They might be episodic. For example, low back pain because of endometriosis actually gets worse by menstruation, while the kidney stones might have other associated features like dysuria, burning micturition, things like that. So the key takeaways is that, as you can see, that pediatric back pain can stem from a variety of conditions. Some are purely mechanical, some are systemic, and some are even psychological. So the best thing is to look out for red flags like, for example, the persistent night pain, for example, an unexplained fever, unexplained weight loss, or neurological changes, because they may point to a more serious cause like infections or tumor. So your job is to differentiate an innocent back pain from sinister back pain based on the red flag symptomatology and red flag signs. So I hope you have understood something about the causes of low back pain in children. If still got any question, put it down in the comment section below and we'll be more than happy to answer those questions. I'm signing off. See you next time. Bye bye.